Good afternoon, I'm Margaret Johnson. We're following breaking news right now at noon involving coronavirus in North Carolina. 7 people have tested positive now for the virus. State health officials are waiting for those results to be confirmed by the CDC. Because of the increase in cases, we are awaiting an update now from Governor Cooper. He is expected to declare a state of emergency over coronavirus. Of course, we will bring you that news conference live as soon as it starts, but here's what we know so far. According to the State Health Department, 6 cases of coronavirus are in Wake County. The latest one involves 5 people who traveled to Boston within the past few weeks for a biogenetics conference. Officials say other coronavirus cases across the country have been linked to this conference. The new cases are not connected to one announced last week in Wake County. There is also a coronavirus patient in Chatham County. It is not connected to any of the other cases. Officials say all of the patients are being treated and are in isolation at home. Governor Cooper and the coronavirus task force will be speaking shortly, and of course we will bring that to you and bring you the results of that. Meantime, happening right now, Wall Street is climbing after its biggest one-day point drop in history. Here's where the Dow Industrial Average is trading right now. The Dow soared by almost 800 points at the opening bell. And investors like President Trump's promised major steps to settle concerns over coronavirus outbreak. The president is meeting with Senate Republicans today at the White House. They'll discuss a potential payroll tax incentive that could put more money in the pockets of workers affected by the virus. Now, this comes on top of the $8 billion spending package approved by the president to combat the virus. And North Carolina Congressman Mark Meadows is among 5 politicians in Washington, D.C. to self-quarantine. He is President Trump's incoming chief of staff. Meadows was in contact with a person who tested positive for coronavirus. It happened last week at CPAC, a Republican conference. Meadows says his coronavirus test came back negative, but he is still isolating himself at home. Meadows was in close contact with President Trump Friday after the conference. Well, the governor is speaking now about the latest on coronavirus in North Carolina. Let's listen in.
Here today. Yesterday, we identified 5 new cases of COVID-19, the new coronavirus, here in Wake County, all linked to a Boston conference last month. That brings our state's total to 7 presumptive positive cases. We anticipate more positive test results from this Boston conference. Right now, we have supplies to test 300 more people, and like other states, we're doing everything we can to get more supplies and more tests to our state. Private labs, like our own LabCorp here in North Carolina, are already testing, and we are working on another mechanism of testing that does not rely on these supplies. We've analyzed the situation using available data and science. We've discussed options with health experts, business leaders, and emergency management here and in other states. The new cases and the advice of these experts have led us to give new guidance to North Carolina residents and to declare a state of emergency for our state. While we do expect many more cases, we can limit the number of people who get seriously ill. The main purpose of declaring a state of emergency is increased flexibility to respond and prevent, as well as to allocate funds where needed. The state of emergency can help speed supplies and gives health and emergency managers more budget flexibility. It protects consumers from price gouging. It encourages insurers to make testing available for little or no cost. And it expands the ability to use more health professionals who are working to respond to this virus. Dr. Mandy Cohen, the Secretary of the Department of Health and Human Services, will speak in a moment to outline today's new recommendations about workplaces and large gatherings. This new guidance is especially important for people older than 65 and those with a chronic health condition. Even though we know that that population is most vulnerable, I ask all North Carolinians to take this seriously. For example, though most young people who have contracted the virus have experienced milder symptoms, they are not immune. Anyone can carry the virus to loved ones or friends who could become ill. Protecting public health means being cautious and being prepared. Today we are both. These recommendations can mean inconvenience, loss of income, or disappointment, but they are based on the best medical advice, and they will be life-saving. We do want people to take this seriously, but we also want them to go on living their lives, particularly those who are not in the higher risk group. We just need them to do it wisely. Here are some steps that everyone can take to protect yourself and your family. Wash your hands often and avoid touching your face. I know we're all doing this more now, but I urge you to continue to do that. Cover your mouth and nose when you cough or sneeze. Clean and disinfect surfaces frequently. Stay at home if you're sick, and have a plan in case you need to miss work. Avoid mass travel and large gatherings if you are in a higher risk group. Finally, here's where you can get the latest information at our North Carolina Department of Health and Human Services website. It's ncdhhs.gov/coronavirus. I know that people are worried about this virus, and I want to assure you that the state of North Carolina and your public health directors and emergency responders are working hard. Our most important work is keeping people healthy and safe. I'm joined today by the Secretary of the Department of Health and Human Services, Dr. Mandy Cohen, the North Carolina Emergency Management Chief of Staff, Will Ray, State Public Health Director, Dr. Elizabeth Tilson, and the Secretary of the Department of Public Safety, Eric Hooks. Emergency Management Director Mike Sprayberry is in Robeson County at a legislative hearing on hurricane response. Lee Williamson is our sign language interpreter today. I want to recognize Dr. Cohen to go over these recommendations, and then I want to recognize the Chief of Staff of the Department of Public Safety, Will Ray, to talk about the emergency management side. So, Dr. Cohen.
Thank you, Governor. So the actions and recommendations we are sharing today are to help us slow the spread of this virus and protect our more vulnerable neighbors. We each play a role in keeping our communities safe and healthy. And we understand these actions are going to have impact on people's lives and our communities. And we're making them based on guidance from the Centers for Disease Control and Prevention, current actions from other states, and the most up-to-date epidemiology evidence that we have to protect our public health. This is a critical moment in the growing outbreak of COVID-19 in North Carolina, when such measures can potentially impact the spread of the disease. Many of the recommendations we're making today are targeted, as the governor said, at protecting people at high risk of severe illness, which includes adults over the age of 65, those with underlying health conditions, including heart disease, lung disease, diabetes, or with a weakened immune system. So here are the recommendations we're making statewide. People at high risk, and by again that means above the age of 65 or with underlying health conditions, should avoid large groups of people as much as possible. These include gatherings such as concert venues, conventions, church services, sporting events, and crowded events, social events. Second, facilities that serve as residential establishments for high-risk persons should restrict visitors. This would include places like independent and assisted living facilities, correctional facilities, nursing homes, and facilities that care for medically vulnerable children. We are encouraging also statewide that event organizers should encourage anyone who is sick not to attend, and to encourage those who are at high risk, described as earlier, above 65 or with more chronic health conditions, to not attend those events. We encourage event organizers to adopt lenient refund policies for people who are at high risk. Find ways to give people more physical space to limit close contact as much as possible. Encourage attendees to wash hands frequently and clean surfaces with the appropriate cleaners. Additionally, travelers returning from countries and U.S. states impacted by COVID-19, please follow the DHHS guidance on self-monitoring. Again, that is available on our website. And so that is our guidance for the entire state of North Carolina. But as you know, as the governor mentioned, we confirmed 5 new cases of COVID-19 in Wake County, increasing that total to 6 in Wake County. And therefore, we have some additional recommendations for those of us in the Triangle area. First, employers and employees in the Triangle should use teleworking technologies to the greatest extent possible. Additionally, employers should urge employees to stay home when they are sick and maximize flexibility in sick leave benefits. We ask employers to consider staggering start and end times to reduce large numbers of people coming together at the same time. Obviously, we know that many people, like those who work in restaurants and teachers, cannot telecommute, and we are not recommending that at this time. Second, organizers of mass gatherings for events here in the Triangle that primarily target or draw high-risk persons, including those that attract older adults, should consider canceling or postponing those events. I want to address schools specifically. The good news is that children appear to be at low risk of serious infection with the virus. This is a different situation than we had during the 2009 H1N1 pandemic. This is why we are not currently recommending preemptive closure of schools. However, the closure of schools might be necessary in some specific circumstances during the course of this epidemic. For example, closure may be recommended when there is need to do any sort of public health investigation, or a case of cleaning is required after exposure in a school or child care setting. And I remind us that this situation is rapidly changing, and recommendations about school closures could change as we learn more. But today, we are not recommending any preemptive school closure. And we know that decisions around school closures are always difficult to make. And we're committed to working with school leaders to determine what is in the best interest of the community their community moving forward. Perhaps the best thing we can do to all protect ourselves, our neighbors, and our state is to be sure that we are getting accurate information. I'm worried about the misinformation that's being shared across social media. It's harmful. Please rely on trusted sources of information. We are updating our website, ncdhhs.gov/coronavirus, regularly.